Good day. So today I'm going to talk on the nephrectomy specimen for renal cell carcinoma. So let us see on the gross specimen of a renal or nephrectomy specimen. So first of all, let me clear all those things. So depends on what type of specimen or what type of surgery that the surgeons do. So basically, in a nephrectomy specimen, you will receive a few structure. Number one, of course, the renal or the kidney itself. And adhere to the kidney is the fibrous capsule of kidney, number 3 is the perirenal fat, in which it's contained also adrenal gland. So you can find adrenal gland within this fatty layer, and all of this structure is encased with renal fascia, and lastly it is surrounded by the pararenal fat. So all of these structure you should see within the nephrectomy specimen, but it depends on the what kind of structure had been removed by the surgeon. So what you obtain or what you receive is varies from surgeon to surgeon. Okay, let's move on to the structure or the nephrectomy specimen here. So when you receive a nephrectomy specimen, it is not as nicely looking as like in the textbook. So basically what you receive is just something, lumps of tissue like this. So you see it is covered with fatty tissue. This is most probably the perirenal or the pararenal fats. So you can see there's a lot of fatty tissue. So it's this color, yellow in color. So this is how basically exterior or externally it looks like. Okay, next I'll try to maximize this image first. Okay, you can see there's some clips here that had been put by the surgeon. Okay, you can see some clips here. Let me highlight it just for you. Okay, hold on. So these are all the clips. This one, this one, this one. There's a few clips here. So all of these actually which could be either it is the ureter, or it could be vessels. So vessels could be in artery and also veins. So all of this structure is important to be evaluated so that you can see if the tumor or the lesions involve all of this structure. So it plays a major role to examine all of this structure, because if there is involvement, then the staging for this tumor will be increased. So what you have to do is carefully identify all of this structure, basically 3 of them: the urethra, the artery, and also the vein, and examine it nicely, and after you examine it, you need to submit a few sections from it, just to identify either there is involvement or not. Alright, so on to the next part. Okay, I'll try to minimize first. Okay, so you can see there's also a part of kidney protruding externally, which are not covered by any fatty tissue, as I highlight it here, and also some of it here. So that's where you can see the kidney there. It is purplish in color. There you can see clearly it's purplish in color, so there's a kidney there. So what we usually do is we need to first identify the structure available here. And take necessary sampling, and also examine it while you take the sample, so that you can evaluate if it is involved by the tumor or not. So apart from that, you need also to measures. What you need to measure is, number 1 is the whole specimen. Number 2 is the length and the diameter of the hollow organ. So all of these structure you need to measure properly, so that you can include it in your report. And after you have done all of those things, what you have to do is to section, or you have to bisect the kidney, so that you can identify the lesions there. Okay, here is the kidney which had been bisected, so you can see that the tumor clearly where it is. So the tumor is actually here. So when you have bisect through here, so it's like an open book, like that. So this is one side, this is another side. So this is one side, this is another side. So you have already bisect it into 2. Okay, we remove that one first. So this one, okay, so you can, just to help you orientate, you can see that this is actually the tumor. Another part of it is here. So because of you already bisect the kidney, the renal, so there will be 2 sides of the tumor, so that are the tumor. Okay, what about the rest of the kidney? So the kidney is actually down here. I will outline the shape of the kidney. So continuous here, here is where you bisect it. Just continue here to here, and here is where you bisect it. Here is the continuation of the kidney. So that is where the kidney. And you might ask me, where are the pelvic calyceal system or the pelvic system of the kidney? So here are the pelvic system of the kidney. You can see it's a little bit dilated here. This most probably there's some obstruction of the urethra going on, maybe due to the tumor or maybe due to something else. So it's a bit dilated. So here are the urethra, the pelvic system, the kidney. So bear in mind the perirenal fat is not only present at the outer surface of the kidney. So the perirenal fat is also present within the kidney. So here is where the perirenal fat, you can find another part of perirenal fat. So why this is important is that you need to identify it and to examine either it is involved or being invaded by the tumor. So this purplish color is the perirenal fat, which contains within the surrounding the pelvic part of the kidney. So it is not within the renal parenchyma, but instead it is just surrounding the pelvic calyceal system of the kidney and situated at the hilum of the kidney. So you can find it perirenal fat there. So because sometimes the tumor tends to invade that perirenal fat, and thus it will increase the staging of the tumor for these patients. Alright, so let me clear everything first. So before I'm clearing, I will put some labeling here so that you can identify what it is. So this is again the not perirenal. So this is actually the pelvic calyceal system of the kidney, and the blue things here is the renal parenchyma. And again, the green one is the tumor. Alright, so you can pause at this point just to have a look or to have some orientation. So next we will go into, I will remove all the markings here, and we will go to how to see and describe what kind of things we. Okay, before we go into detail into that part, I would like just to show to you on how do you measures, apart from measuring outside of the renal or the specimen, you also can also measure from the inside. So this is a little bit accurate compared to the measurement from the outside. So what you can do is you take measurement from here to here. How many? Usually we measure in millimeter. So how many millimeter is that part? And from here, this one from till here. So what are this part? So that also you can take how many millimeter, and the full thickness is you can take from the outer surface of the specimen. So that one clear. So we go into details, not details, I just help you to orientate and also to to okay, here, sorry, the picture is a bit okay, nice. So you can see this is the tumor. It is well, sort of well demarcated kind of tumor. So you can see this nicely almost contain a capsule-like structure, which is a whitish layer just outside the renal, the tumor. You can see there's some cystic degeneration. I will highlight with blue color. So previously, before that, capsule, and inside there is the tumor. Okay, I will highlight the cystic degeneration of the tumor. So these are actually the cystic degeneration. So it's formed a cystic because of you had already this specimen had already been dissected or bisected. So it will leave some space like here. So it is actually some cystic degeneration of the tumor. It can be caused by necrosis, or sometimes the tumor itself form a cystic expansion. Maybe it secretes something inside the parenchyma. So that's what caused it to form a cystic-like structure, like so. Alright, the rest of the tumor appear to be dusky in color. So these could be two things. Either it's the tumor itself, or it could be caused by necrosis. So either things can cause this type of color, a bit dusky, or sometimes they also use tan color, depends on what your preference. And at the center here you can see some reddish spot there. So this is how a little bit micro or a smaller spot of hemorrhage that are present in the tumor. So that's how it looks like. So apart from that, you also need to identify and also measures the tumor. Okay, bear with me, I'm trying to adjust the tumor. Okay, put it over here a little bit. Okay, alright, hold on. Okay, so you can see that this is the tumor, sorry. Okay, so this is the tumor. Again, another part, the other side of the tumor where you already bisected it. So this is the tumor. So what you have to do, apart from taking the measurement of the kidney or the specimen itself, you also need to take the measurement of the tumor from the kidney. So you take, usually we take 3 dimensions. Number one is this one, so superior inferior measurement, like this. So you take how many millimeters it is, and then you take the measurement from the horizontal measurements, so how millimeter, and the thickness is available when you measures at the outer surface. So you need to base or compare with the section that you had done for the tumor. So with that, I think I will end my video. So again, you can see again the tumor. So at any point of this video, you can pause and take a look at the notes that I had written, and if there is any questions, you can just text me, message me through these links or comments available down below, or you can personal message me afterwards. So by that, I think thank you and have a nice day.